Welcome to my workshop on fading puppy syndrome. If you breed long enough, unfortunately, you will encounter fading puppies. It is unfortunate, but true. So do watch this video so that you're prepared when and if it happens in your nursery. My name is Paula Vandervoort. I am a veteran boxer breeder, and I'm also breeding Boston Terriers at this point. I do judge occasionally. I've been a natural rearing dog breeder for, maybe 15 years or so, and I've been breeding for 5 decades. I'm the founder of the Dog Breeder Store, which is online, and I have a ton of training in alternative medicine for dogs and a BS in animal science. I'm the co-founder with Crystal Beers of the Natural Rearing Breeder Connection, where we connect people together with natural rearing breeders, and there's another workshop on that. Today, I want you to come away with an understanding of what exactly fading puppy syndrome is. You'll understand how the newborn's immune system and the mom's colostrum play together to build up immunity during those first critical days, and how these factor into puppies that fade. You'll also learn to recognize when you have a fader, almost even before it happens. I want you to have the knowledge of those symptoms so you can get those puppies removed and into intensive care before they fade, and know how to support them if they do fade. We're going to go over what we think causes fading puppy syndrome and the treatments and preventives you can use in your own nursery. You'll learn how to use both safe and effective homeopathics along with biological nutritional supports to save your babies. You'll learn how to watch for adequate glucose levels, calories, and body temperature, and how to adjust if those go awry. And you'll come away with more resources in case you want to dig deeper on fading puppy syndrome. So, fading puppy syndrome is not really an official diagnosis. It's a set of symptoms together that are just sort of thought of as a syndrome. And unfortunately, here are the statistics. 30% of puppies die within the first 2 weeks of life, and 50% of those puppies die within the first week, often attributed to fading puppy syndrome. It can also occur as late as 10 weeks of age. I've seen that happen. And one of the factors that plays heavily into this is whether or not the puppies have ingested colostrum within the first 12 hours of life. There's a set of symptoms that seem to encompass this syndrome, and usually most of these are present. It's so important to watch for any of these. One thing I was taught by my mentors was to bottle every puppy every day. This gives you the opportunity to have each puppy in your hands individually, and you can actually feel how well they're doing. You'll be able to feel if they're cooler than their siblings, for example. We'll go over normal body temperature shortly, but this is a skill that every breeder should have. You'll also be able to feel their chi, or energy. Faders tend to feel cool and kind of hunkered down. Many faders also have trouble latching onto a nipple, and they may just try and then fall away as the others are nursing. It's imperative that those who aren't latching well are allowed to nurse without competition, and preferably from the rear nipples where there is more milk flowing. Sometimes faders get pushed away by the moms, and although this is very sad and seems unfair, it can be normal for a small percentage of healthy puppies to fade. This seems to be a preservation skill that is innate in dogs. They give birth to multiple offspring in the wild because there is expected to be a certain loss. The moms innately want those who are stronger to get the most milk and warmth. And if they have to sacrifice a baby, it'll be the one with the lower body temperature and lower chi. If you walk in and you find a cooler puppy away from the others, this is a probable sign that this is an impending fader that can quickly lead to death. So when you are bottling or holding an individual puppy, they may feel like they're trying to conserve energy. A thriving puppy tends to twitch while they're sleeping, and they move around a lot. A struggling puppy doesn't have the extra calories to spend on those movements. Fading puppies may exhibit something called paddling. They have paddling motions with their legs as if they're trying to relieve discomfort. This can be a sign of intestinal distress or other underlying issues. And they may also have a high-pitched cry or an unusual sound, unlike the others that indicates that they're in distress. Sometimes they sound a little like a seagull crying. And I recommend that you weigh each puppy every day or even twice daily in the beginning, because failure to gain weight at the same rate as their siblings can be a big issue. Puppies often lose weight in the first few days in the wild because they're only getting that thick colostrum rather than milk. But this is unnecessary in a modern nursery. The mentoring advice I'm giving is to bottle each puppy every day can also prevent weight loss. You don't want to exclusively bottle them unless they can't nurse on their own, because the mom needs those babies nursing to bring her oxytocin levels up to produce milk. We offer a set of whelping forms at the dog breeder store that are very complete and can help you keep track of all these little nuances. They're especially helpful when you have multiple puppies and you're running on little sleep those first few weeks. Keeping records can help you catch a problem as it's developing. Our forms help you to graph the trends so that they're very evident. And it's important to check for dehydration trends in your little ones as well. You'll be able to pull the skin up on the back of their neck. If it's supple and it goes back down easily, they're usually hydrated. If it doesn't, it's kind of sticky, then they're usually dehydrated. A dehydrated puppy also tends to have sticky gums. And sometimes you'll even see seizures in puppies that have low glucose levels, for example. And the unfortunate thing is that if we don't catch these symptoms, they often progress to lethargy, they'll lose their body tone, and then they die. So what causes fading puppy syndrome anyway? Well, first of all, puppies cannot regulate their own body temperatures for the first couple of weeks. Newborn temperatures they start at around 95 degrees internally, and they start to move up over time to where they get to be a normal temperature. But anything below that is life-threatening. And in combination with that, humidity should also be kept at around 55 to 60%, preferably. You can put a warm, wet washcloth in the box if you have them in a warming box, and you can replace it when it cools. Or you can use a humidifier intermittently. We actually use a cold diffuser near our nursery with purification and thieves, essential oil blends, running 24/7 intermittently. That keeps our environment free of pathogens while also adding appropriate humidity into the ambient air. And if a puppy's not moving its food through its body, especially in combination with dehydration, they can begin to exhibit signs of fading puppy syndrome. And sharp observation is required. Any puppies who are struggling should be removed to a warming box or an ICU until they're stable, and their eliminations and body temperature should be supervised. A puppy enema can be given to a constipated puppy using a standard tube feeding kit from the dog breeder store. You can use warm water or a little bit of a stool softener such as Colace, and we have videos on how to give puppy enemas available on YouTube at the Dog Breeder channel. Now, puppies also may be born with an internal birth defect that isn't evident. Recently, we had a fading puppy in our own nursery who was given all this supportive care, and she still perished at 3 days of age. When we did an in-nursery autopsy, she had a constriction around her cecum, which is between her large and small intestines. This was a puppy who could not have been saved. But other issues such as cleft palates can be so slight that you miss them, yet cause them to not be able to nurse properly. So always check every puppy very carefully yet gently with good lighting to be sure there is not a midline defect that may be kind of slight down the roof of the mouth. It may be actually in the very back of the roof of the mouth. And according to a study conducted by Fox and Reed, inbreeding leads to differential fitness loss in different environments. Inbred individuals are often more sensitive to environmental stress than are outbred individuals, presumably because stress increases the expression of deleterious recessive alleles or cellular safeguards against stress that get pushed beyond the organism's physiological limits. Many breeders don't understand that all purebreds are inbred simply because of their limited gene pools. So outcrossing regularly can increase vigor in their breeding programs and help to prevent faders who are more susceptible to stresses in the nursery. So watch those inbred litters very carefully for faders. Low glucose levels can also be a factor with faders. You may see severe lethargy and even seizures. You can swipe a glucose source, such as I use organic maple syrup. Some people use Karo, but I don't like the corn that's in it. But they wipe that onto the gums. And this can be your first treatment, and often it's life-saving. Sometimes moms have challenges with maternal instinct, and they're not really good mothers at the beginning. And although new moms are more likely to have those issues, those with low calcium often display aberrant mothering behaviors, including lack of mothering. They may be pushing the babies away. They may leave the whelping box. They may even be aggressive. And we've seen it also progress to infanticidal behavior. In those cases, administration of calcium paste, such as Nature's Pharmacy calcium paste or Oral Cal Plus, those can make a huge difference. We always keep organic vanilla ice cream on hand for our new moms. They're offered it both during whelping and all throughout lactation. And although ice cream should never be your only source of dietary calcium, it's a nice add-on. Now, sometimes it appears that all the babies are nursing and getting milk, but the milk volume or quality just isn't present. I've seen entire litters die in newbie nurseries when the breeder thought they were all nursing, but there was actually little to no milk flowing. So be sure to express each nipple to be certain that milk is flowing and there aren't any weird colors. Colostrum is present at first, and it is thick and yellow. And after that, the milk you express should be thin and almost bluish in color. There should be no blood or green coloring in healthy milk. Puppies are also susceptible to infections as neonates. Of course, see your vet if it's needed. Again, we run a cold diffuser with Thieves essential oil blend along with purification. This is very helpful to keep the pathogen load down in the nursery area. And we also use natural cleaners that are safe for the same reason. We use Thieves household cleaners. Sometimes puppies have traumatic births, and they end up struggling until they become stabilized. So if you have a puppy who became stuck or had a lengthy time in the birth canal, be sure to keep a close eye on them. You can put a tiny drop of an essential oil blend called Tea Away on the spine of any puppies who experience trauma. This will help mitigate trauma being stored in cells and support any injury pain they may be feeling. It has an essential oil called helichrysum in it that's amazing for these purposes. Helichrysum is very expensive, and the blend is much less expensive and very effective. Obviously, puppies with low birth weight, they're often called runts, they're at higher risk, and they should be observed carefully. Weigh them preferably in grams if you can at the beginning so that their records are extremely accurate. And although intestinal parasites can be a big factor in fading puppy syndrome, especially those who are born with hookworms, for example, it's never recommended to just worm them with chemical wormers for insurance. They can do more harm than good, and many parasites have developed chemical resistance to drug wormers. Always be sure your girls are parasite-free prior to breeding, and if you suspect worms of any kind, have fecals run either through your own microscope. I have one that cost me $100, or in a veterinary lab to get a positive ID on them. We use food-grade diatomaceous earth in their bottles and weaning mash if needed. And there are some homeopathic wormers such as Worm Clear or essential oil blends like Paragize that you can use, but get a diagnosis first. Then we also have possibility of viral and bacterial overloads. The same rules apply. Don't just give antibiotics just because you suspect a bacterial infection. Antibiotics wipe out their very immature gut microbiome and ruin their immune systems. Antibiotics should be given with great caution and under the care of a veterinarian with a diagnosis, not just a guess. And lastly, toxins can be a big factor in fading puppy syndrome. Many of the common household cleaners that breeders tend to use that kind of burn their eyes, they have elements in them that are toxic, not only toxic to dogs in general, but they're deadly to neonates. They can contain phthalates, triclosands, ammonias, bleach, and other ingredients. Some of them often contain endocrine disruptors. And we'll be going over how we keep our nursery disinfected in a later portion of this workshop. Although you should always have a vet who can be available on call, often there just isn't time, and emergency vets just do the same things we recommend here and charge thousands for the same services. A good breeder can always save puppies. So if you have a senior mentor, buy them lots of chocolates and be sure they're available to give you guidance. Neonates, and especially those of tiny breeds, are more susceptible to hypoglycemia than larger or older puppies. So be alert for any one or a combination of the following atypical behaviors and symptoms, including weakness, being very sleepy, being disoriented, being wobbly, or in the case of the mom, a drunk kind of a gait, having glassy or unfocused eyes, abnormal twitching, shaking, trembling, and shivering. A healthy puppy twitches, and one with low blood sugar sort of shivers. If their head is tilted to one side and stays there, and if they have seizures or loss of consciousness. So the home treatments that are available to you can be things like using a fingertip of NutriCal or organic maple syrup. Sometimes you can just put that on the gums, and that's all that's needed. You can also make sure that you have a hypoglycemic puppy warm, because that thermoregulation goes out the window even on older puppies if they have low blood sugar. Now, a truly hypoglycemic puppy can be a veterinary emergency, so be prepared to keep your puppy warm and call your vet if home treatment doesn't bring them around quickly. Newborn puppies cannot thermoregulate for about 3 weeks, and they have a temperature that gradually goes up as they grow. Puppies are born with an internal body temperature of around 94 degrees, and it goes up to about 97 by the end of their first week of life. In the second week, they usually can hold a temperature of around 97 to 99.8, and by the end of the third week, they can hold a dog's normal body temperature of 100 to 101. So during that time, it's absolutely critical that they don't become chilled, and chilled puppies can be a factor in fading puppy syndrome. We never recommend heat lamps, as they can be very dangerous, as well as they can cook the mom from above. Babies who are struggling should be put in a warming box with a hygrometer and a heating pad that is closely monitored to be certain that they also don't get cooked or get too cool. We also always recommend that struggling puppies are removed from the litter until they are stable, as too often one gets pushed away, gets too cold or dehydrated, and may be found already perished. Be sure that your heating pad has an always-on setting. Many modern heating pads turn themselves off to prevent humans from being burned while asleep. We test all our heating pads to be sure that they do not turn themselves off, because many of them don't even say this on the box. Any puppies who become chilled should be warmed slowly, and they should never be fed until their body temperature is in the normal range. Lack of nutrition can be a factor when puppies are fading. Some mothers appear to be nursing their babies, but actually are putting out very little milk. Be sure to express milk regularly to check it for volume, color, and to be certain it does not have blood or kind of funky coloring to it. Of course, colostrum for the first couple of days is all you'll see, and it's thick and yellow. But if milk supply is low, An herb called fenugreek can be very helpful to increase milk supply and improve milk quality, as can feeding a species appropriate raw diet with plenty of raw bone during lactation. Now, newborns should be fed, if you're feeding them manually, at least every 2 hours, and approximately 1 cc per ounce of body weight, or go with the instructions on the formula label. If the baby's not successful with bottle feeding, you can use our tube feeding kit appropriate for your breed size. And we offer a homemade recipe to boost immunity in our articles section at the Dog Breeder store and on our YouTube channel, the Dog Breeder channel, or you can use a commercial formula. Our commercial formula of choice is called Puppy Back because it contains no synthetics, but it does have enzymes, probiotics, and micronutrients that best represent mother's milk. Some of the formulas out there have a lot of synthetics in them. This one is based in goat milk. Never use cow's milk with puppies. And if you are bottle or tube feeding, be sure to stimulate urination and defecation for the first 2 weeks of life. There are some great commercial formulas available for puppies. Just make sure you're not using something synthetic. Pet Egg makes a synthetic type formula that I'm not real thrilled with. I like Puppy Back from Nature's Pharmacy, and I use that as the basis for my immunity formula, or I use raw goat milk. And you're welcome to take a screenshot of this. This is a formula that I came up with that is based on a formula that Myra Savant Harris put out in her books. It just has some extra things in it to help pump up the microbiome on a puppy. You can do any or all of this and come up with a really nice formula for your puppies. So I do strongly advise that at least when you begin to wean your puppies, that you wean them onto something like this, or raw goat milk, or Puppy Back, or something of that nature. Fading puppies are often dehydrated, and when they become dehydrated, you can often discern this by feeling for sticky gums, or you can pinch up the skin at the back of their neck, which is where their withers are. If it's supple and it flows back down easily, the puppy is likely properly hydrated. If the skin stays in the air, or if it feels kind of dry or stuck, or it flows down very slowly, you can always try adding bottle feeding or tube feeding. But if these aren't successful, hydration by subcutaneous injection may be required and can be done at home. Just don't be afraid to do this. It's better to try than to lose a puppy. You do not need to be a phlebotomist or find a vein. You can use slightly warmed sterile saline or lactated ringers, whatever you can get. Those tend to be available from the Dog Breeder store. You clean the back of the neck with an alcohol wipe, pinch up the skin slightly, and just barely poke a sterile needle just under the skin. And you slowly inject the liquid until a nice ball forms under the skin. Typically about 1 cc per 1 ounce of body weight is about right. But just use good observation skills so you don't overinflate under the skin. Go low rather than high. And never use the same needle twice, even on the same puppy. And never inject cold liquids. And by the way, the liquids must be sterile. If the saline comes in a container with a screw-on lid, do not use it because it has been exposed to the air and it may be contaminated. A thriving puppy is pink. A fading puppy may be pale or even bluish around the lips. If your puppy's color isn't nice and pink, and you have an oxygen concentrator or an oxygen bottle, which you can get at a welding shop, you can also try a blow-by method. Just move the oxygen back and forth in front of the puppy's nose as they breathe until they have better coloring. You can also use continuous oxygen in your warming box, or if you have an ICU set up, but just be cognizant of the setting on your regulator. You're safe between 0.5 to 2 liters per minute setting. Oxygen run at 1 liter per minute is about the same as room air oxygen. When it's run at 2 liters per minute, you have around 25% oxygen, which is versus room air, which is around 21% oxygen. I usually keep mine set at 2 liters per minute. Higher levels can cause blindness because of retinal damage. Don't go above that level without guidance from your vet. And keep in mind that oxygen is extremely flammable, so never use anything flammable near it. No smoking, candles, or using anything like petroleum jelly products on the concentrator, as it makes the oxygen more flammable. Many breeders unwittingly use toxic chemicals in their nurseries. They want to be sure there aren't pathogens present, but these can also cause puppies to fade. I used to think that if it didn't burn my eyes, it wasn't cleaning. But things like bleach and ammonia and actually even Windex are quite toxic to babies. I suggest that you learn to read labels and be able to identify household products that are hazardous to your puppies. You can always go to the environmentalworkinggroup.com to check any product that has a barcode on it that you're considering using, or you can use an app that's called Think Dirty. We actually use a product called Thieves Household Cleaner in our nursery. It's used by many veterinarians in the VMAA, the Veterinary Medical Aromatherapy Association, to clean their surgeries because it is so capable of killing pathogens while being completely safe with neonates and their fragile surgical patients. I really don't even worry about the overspray when I'm cleaning. If the puppies are playing around me, if they happen to swallow it as I'm spraying or lick it off the whelping box, it's completely safe and it'll make your nursery smell amazing. Puppies who have experienced traumatic births can also exhibit fading puppy syndrome, and they can benefit from a couple of natural treatments. One of them is homeopathics. You can give homeopathic Staphysagria or Carbo-Veg in 30C potency to these puppies. You'd give it every 15 minutes until they're very much better. If it's in pellets, you can dissolve it in a little bit of water and just put a little drop in their mouth. Carbo-Veg is one of the ingredients in our fading puppy remedy liquid that addresses these issues as well. We really love to use homeopathics to support our moms and babies, especially if they're struggling. There aren't very many medicines that are safe with pregnant and lactating moms or for newborns. Most homeopathics are safe as well as affordable. Because they contain only energetics and information, they don't react with other supplements or medicines, and they really can be life-saving. In a moment, I'm going to talk about some homeopathics in the nursery and a combination of supports that can be really helpful with fading puppy syndrome, including 2 products called Fading Puppy Remedy and Fading Puppy Support. In addition, there are also essential oils that are formulated for use with dogs and children specifically. They're available from Young Living, and we use them in our nursery very safely for a very long time. There's a blend called Tea Away that helps to mitigate the effects of trauma with young puppies. So if they've been through a stuck puppy situation, or they've had their dewclaws removed or tails docked, we just take a tiny drop and rub it down their spines once or twice a day. And it can help to mitigate the trauma. It's amazing to see how everybody calms down with Tea Away. But now let's discuss the importance of colostrum in preventing fading puppy syndrome. So it's of utmost importance that your puppies ingest colostrum or a substitute within the first 12 to 24 hours of life. The sooner the better. Colostrum is a thick yellow substance that comes in immediately after birth. It's replaced soon by thin bluish milk. And there is some evidence that foals who do not ingest mother's colostrum often die. So this may also be relevant to puppies. Sometimes puppies cannot get colostrum because their suck reflex isn't present due to immaturity. They just can't get it without help. So some breeders or vets will actually strip colostrum from the mom's breast and give it to the baby with a tube feeding kit or even with their finger. Stripping colostrum, I can tell you, is pretty challenging in my experience, but if you need to do it, be ready and have this equipment on hand. This is 3 different pictures of basically the same thing. I call it a breast pump. You use moist, warm packs on the mom, and that can help her to release the colostrum to you. You can try to express it by hand like you've seen cows being milked, but if that doesn't work, you can try this method. I keep a 10 or 20 ml empty syringe on hand that I have sawed. I cut the tip off, I sand down the edge to make it smooth, and I put the plunger in that end, so I switch the plunger to the other end. If it's tight, you can put a little olive oil on it to smooth the action. You can place the flat end of the syringe around the nipple and use a very gentle plunging to express the colostrum out. If you can get a cc for toy breeds or about 4 cc's for larger breeds, you're in great shape. And by the way, I want to give big thanks to my friend Myra Savant Harris, who's an RN, for this tip from her book, Puppy Intensive Care, which is available in the dog breeder store online. So if stripping colostrum is not possible, there's another alternative, but it does require you to either go to the vet with the mom or draw her blood and use a centrifuge to spin it to clear serum. I recommend that any long-term breeder learn to draw blood using the many great YouTube videos put out by veterinary phlebotomists. There is one on the playlist for breeders on the Dog Breeder channel that I really like, and I use that when I need to draw blood from my own dogs. I also recommend that you purchase an inexpensive centrifuge. I got mine on eBay for $60. Syringes, needles, and various blood tubes. You can get clear, red top, purple top, tiger top. You'll use them all eventually. Mom serum can be injected into the intraperitoneal cavity, which is the non-organ part of the abdominal cavity, which is a little scary, or as a second choice, under the skin at the withers, as we described earlier, or as a third choice, it can be given orally. Oral administration is only useful in the first 24 hours or so. That's the same period during which colostrum antibodies can be absorbed by the gut of a newborn puppy. This can convey antibodies to the babies. Another choice is something you need to do in advance. I always have this in my freezer before whelping, as it can really be life-saving. You can purchase a product called Fresh Frozen Plasma, abbreviated FFP. It can be purchased from Homeopathics online. They keep a colony of spayed and neutered protected greyhounds that have the universal canine blood type. They regularly donate blood, which is separated into the needed components. It contains immunities for all the major things that puppies may get, such as parvoid or distemper, and a large number of other diseases. You can order this ahead of time. They'll ship it to you frozen by overnight express. It has a shelf life of about 5 years in your freezer for antibodies and about a year for clotting factors. So it's great to give if you have a bleeder when you're removing dewclaws or docking tails if it's under a year old. So for a toy litter, 1 or 2 tubes will be sufficient. For larger breeds, you need to contact Hemopet to get help deciding how much to order. But we always have a large bag in our freezer before litter is due here. To administer, you thaw it and warm only what you plan to use to about body temperature. You can keep the rest refrigerated, and you can then refreeze the leftovers for another time. The instructions that come with it are very complete. So what about the other kinds of colostrum? Are they useful? There are a variety of milk replacers that have colostrum in them, and you can buy straight colostrum, but I have yet to see one with canine colostrum in it, as they are mostly bovine colostrum. Of course, cattle don't have the antibodies to parvo or distemper in their colostrum that they are nursing to their calves. So although colostrum from cattle is a very useful product for things like allergies and bowel function, it's not going to convey canine antibodies to your puppies. This is a picture of one of my own homeopathic kits. It's a kit with 100 of the most commonly used remedies in it. And these little vials at the bottom contain pellets with medicine on the outside of them. So a lot of people confuse the word homeopathic with holistic. They are entirely different things. Homeopathics are a system of medicine. Home means homonym or similar or like, and pathy means pathology. So the meaning of the word homeopathy is in the word. Its definition is actually in the word itself. Homeopathics are a system of medicine that is both preventive and treatment based on symptoms. Homeopathic medicine is one of the oldest and most revered medical systems in the world. It was developed during the late 1700s in Germany, and it's widely used in Europe and most first and second world countries. It was the medical system of choice for the late Queen of England. We all know how long she lived. It was established in America with the first homeopathic college that was in Allentown, Pennsylvania in 1835, until Big Pharma was responsible for pressuring practitioners to use more profitable, patentable prescription medicines. Homeopathy has a global popularity that far exceeds its use in the United States. In Europe, approximately 40% of all physicians either use or refer patients to homeopathy, and it's part of the national healthcare systems in a number of countries, including Germany, Switzerland, the United Kingdom, Greece, Israel, India, Pakistan, and Mexico. The World Health Organization states that homeopathic medicine is the second most popular medicine in use. Veterinarians can get an accreditation from Pitcairn Institute of Veterinary Homeopathy. They offer a 140 credit hour accreditation for DVMs to learn how to use homeopathy in their practices. So I want to show you a homeopathic remedy that is available from the dog breeder store, Fading Puppy Remedy Liquid. It's 100% homeopathic preparation, regulated and licensed by the FDA, and it's made in a licensed homeopathic pharmacy. It's based on a century-old formula from Europe, and it's been modernized by me. As a homeopathic, it's extremely safe for pregnant moms, especially those with a history of loss, and for newborns who are struggling. It basically addresses the energetics of why a puppy fades. It teaches the puppy's body how to heal itself by providing the encoding of the homeopathic instructions. And we also have some other homeopathics in the store I'm just going to briefly mention. One of them is called no-sodes. And we've all been exposed by now to the dangers of over-vaccinating young puppies and vaccinating puppies too young. And I've seen the propensity to over-vaccinate being slowly withdrawn from the veterinary and breeding communities, especially due to the advent of accessibility to research such as Dr. Ron Schultz's University of Wisconsin studies on the side effects and efficacies of vaccines in dogs. So how do you protect your puppies if you're worried about adverse reactions to vaccines? Well, with extreme immune systems in place and great diet and gut microbiome supplementation like probiotics, you can also consider using homeopathic no-sodes to augment immunity to the usual puppy diseases. There is a lot to know about how no-sodes work, and they're not at all like vaccines. They don't carry the risks of vaccines. We've had several puppies with parvo who've been naturally reared with no-sodes and raw diet go through parvo like a mild cold. This is a workshop all on its own, but it's well worth learning about. There are also homeopathics available to help a dog through the whelping process safely. In particular, I like this yellow kit at the bottom. It's a kit that was made for humans, and I've written a Materia Medica set of instructions for dogs so that you can use it in whelping. And I particularly love the homeopathic called Colostrum and also one called Gelsemium. They help with stalled labor. I like Hypericum for pain, and I like homeopathic calendula to prevent infections. There's another one in the kit that I love called Cali Phos with a K, because it helps when energy is low for both the girl that's in labor and also the breeder. So we offer that whelping kit, homeopathic whelping kit with a set of instructions. And we also have homeopathics for things like kennel cough. They are very effective for both prevention and early treatment. These no-sodes you don't start using until the puppies are weaned, but I just want you to know that these are available. So not only do we have a Fading Puppy Remedy Liquid, homeopathic, but we also have put it together with a deep dive book on fading puppy syndrome that you can use as a reference if you have a puppy that's struggling, you don't have time to watch a video. And we combine it also with a biological support called Fading Puppy Support Powder. This kit has meant life to many struggling puppies, and it can also be very helpful when a breeder's girl has a history of loss of puppies. So do check that out at the dog breeder store. I promised to talk a little bit about non-toxic cleaning of a nursery. This is a picture of the Gentry Boxers nursery on a typical day. There's puppies inside of it. And you'll note there's a large bottle of Thieves household cleaner. It's hanging from the whelping pen. There are always 2 of these, 1 on each side. We clean the nursery and the potty area and the raw diet food prep and basically everything with it. It's normally in home use diluted about 40-1 with water, but we dilute it about 30-1 with water just for a little extra cleaning power. And anybody who's been around a pile of puppies knows nurseries can smell due to the fact that lots of babies are being potty trained at the same time. It's basically poopalooza. So we start before babies are born diffusing Thieves essential oil blend and purification in rotation 24/7. We often also use Stress Away along with calcium supports if the mom has difficulty settling down and mothering. I have a high-end microscope in a lab, so I'm able to monitor fecals for parasites, and you can use a veterinary lab. But if I see evidence of parasites and not before, I will put Paragize on bellies 1 to 2 times daily, and I'll add food-grade diatomaceous earth into their food or bottles or weaning mush. And then for those breeds who are docked or have dewclaws removed at birth for breed standard, we use an essential oil called Mendwell for healing. The oil blend that we find most valuable for all animals, besides helichrysum, is called Tea Away, and we talked about that before. All babies and moms go through trauma in the birth process, as well as if these medical procedures have to be done. And I insist that Tea Away be applied down the spine every day while things are healing for babies and mama dogs. Again, this keeps them from storing trauma in their cells. It may be quantum in nature, but it's very effective. There are lots and lots of references that if you want to dig deep, you can find out more about fading puppy syndrome and homeopathics and natural things like essential oils for treatment and support. You're welcome to screenshot this. This is just some of the references that I've used in preparation of this workshop. And here are a couple more that are really worth calling out. I belong to the Veterinary Medical Aromatherapy Association and have actually taught for them on occasion. It's vmaa.vet. They keep the largest database of safety and efficacy with animals and essential oils anywhere. There's also a book called The Forever Dog by Dr. Karen Becker and Rodney Habib, and their educational sites are wonderful. You can also go to the dog breeder store or Gentry Boxers. We have lots and lots of educational information there, and we have a YouTube channel as well. Here are the links for the educational articles at the dog breeder store. You'll find education and articles at the top in a drop-down menu. We also run an organization called the Natural Rearing Breeder Connection for anybody who's using more natural supports like homeopathics. That organization is designed to help breeders connect with buyers who have common goals. It's nrbreeder.com. I run a free Facebook group, a couple of them. One of them is for the Natural Rearing Breeder Connection. And then I also run one called Gentry Boxers Natural Rearing Group. Teach in it almost every day. Also, Dr. Will Falconer has a wonderful site called Vital Animal. They have a course in there called, it's a Natural Rearing Roadmap course, but there are also a lot of little courses in there that teach you about homeopathics, for example. He is a homeopathic vet, I think for 40 or 50 years now. Who I met when he lived in Austin. There is a book in my store called Natural Rearing. It's written by Dr. Jeannie Thomason, and she is a mentor of mine and also founded the American Council of Animal Naturopathy, where I went to school. And then lastly, there are some books that are written by Myra Savant Harris, who is an RN. She has a book, a set of books for crisis management that's more in the traditional medical arena. And I carry her books at the dog breeder store, and she has a group on Facebook, so you can grab those links as well. Well, here are all the ways to contact me. That phone number at the top is a business landline. We're in the Texas area on Central Time. That is not a line you can text on, but you can call during normal business hours. We do coaching. We also sell a lot of the supplies that we talk about in here. We put out a newsletter. We try not to spam people. And we have a lot of educational videos on the YouTube channel called the Dog Breeder Channel. If you want to learn about my own natural rearing breeder program, you can find that at gentryboxers.com. I raise boxers and now Boston Terriers. If you want to learn a little bit more about Young Living essential oils, you'll find us at kindredoilers.com and also on a Facebook group of that name. You'll find me on Facebook, and I'm starting to learn to use Instagram. And then again, we have the Natural Rearing Breeder connection at nrbreeder.com. Thank you so much for watching this workshop. I hope that it helps you save puppies. I wish you the best with your babies, and thank you for watching.